Turn your mind on and your TV off. It's time to hear the real truth behind what's really going on. Join Tia Severino, an advocate for truth, freedom, and spiritual growth, as she explores the real story behind what we are made to believe on her show, The People's Truth. In the next hour, you'll be exposed to shocking revelations, to lies you have believed in all your life. Together with her guests, she will unravel the facts behind the current events, health, wellness, faith, justice, and more. As Orwell said, in a time of universal deceit, telling the truth is a revolutionary act. Join the conversation, leave a comment, or call in live 678-495-4345. Don't forget to like, share, and help spread the great message out. And now, here's Tia Severino.
Hello, and welcome to The People's Truth, where we dig deep into the issues that are really affecting our world. I'm your host, Tia Severino, and in this episode, I'm bringing in one of the gold sponsors from the Next Steps conference that took place over the last weekend. I'm talking about Dr. Krishna Doniparthi from Functional Medicine of Georgia. Dr. Krishna Doniparthi is a practicing physician for 20 years in both private practice, family functional medicine, and hospital-based emergency medicine. In 2008, his focus turned to functional medicine, which addresses the root causes of health problems. Specializing in obesity, addiction, pain management, and regenerative medicine, he regularly lectures both nationally and internationally on a wide variety of topics of interest, such as cell regeneration therapies, toxicology, hormones, nutrition, pediatric special needs, epigenetics, and others. He trains physicians in cell regeneration through Neurolipid Research Foundation, where he serves as the chief medical officer. The foundation is known for its research and training regarding pediatric and adult health issues associated with autism, seizure disorders, dementia, ALS, Parkinsons, vaccine injury, and environmental toxicology. He also serves on the scientific advisory board for BR+NAD Addiction brain health. He was born in India and moved to Chicago at the age of 5. He attended Loyola University and is a graduate of the University of Alabama as a chief resident. And with a bio like that, I am honored to introduce you to Dr. Krishna Doniparthi, or as his patients and friends affectionately call him, Dr. D. Dr. D, welcome to The People's Truth. We're so glad to have you, and thank you so much for agreeing to sit down with us today and talk about functional medicine.
Thanks, Tia. It's so nice to be here.
Well, we're glad that we stole you from wherever in the world you were originally, whether it be India or Chicago. We're glad to have you here in Atlanta, in the Atlanta, Georgia area, where you are serving families here. And you, like I mentioned, were one of the gold sponsors at the Next Steps conference just this last weekend. So we'll talk about that a little bit in the show too. But I want to start out by asking you a question that I would ask any doctor. What inspired you? What drove you to become a doctor? And it sounds like it was a winding road that led you to functional medicine. So what was it that took you into this particular field of medicine?
Well, sure. I mean, it's like most other doctors. We all want to help people, our patients, get better. But the difference is that conventional medicine, many of the times, people don't get better, they get refills. And so that doesn't really solve their problems. I mean, certain things do for sure. Say, for instance, surgery. If you have a broken bone and you need the bone fixed, that your best bet is an orthopedic doctor. They're going to fix the bone. You don't have to see them again. But much of regular medicine is about continuing symptomology care. So if you have sleep problems, you keep taking a sleep pill, but it doesn't address getting rid of why you're having sleep problems and so on. So in training, that's what we did. We did symptomology care. And so you came to a problem, we find a pill for it, and then we see you 2 or 3 or 6 months later for the same thing.
And nobody's really getting better.
Not necessarily. There's very few times. Of course, you go to your primary care doctor and you might get half sore throat and it might be strep and you take something for it and then it's finished. But lots of other things that afflict us, high blood pressure or diabetes and so on, don't necessarily get resolved.
So you spent how many years in conventional medicine before you said this isn't working and I need to find solutions that work for my patients so that they can experience a better quality of life? How long did you spend in that conventional, what we call, the traditional, it's not traditional, but the standard of care style of approach of
well, for those who don't know, in order to become a doctor for just primary care, you're talking about undergraduate, then going to medical school for 4 years, then 3 years, at least 3 years of training, residency training, and then finally to practice. But it was during my residency training that, and the program was great, don't get me wrong. I've learned a lot of good information from the residency program at University of Alabama. But it was during that time I realized that patients weren't really getting better. They were just, again, getting refills for their chronic medical conditions. And it was a little bit right after graduating. I actually didn't go do much family medicine. I went into urgent care, which is more episodic care. So if you saw me in urgent care, you had a cut on your finger or something, I will stitch it up and you're done and won't have to see me again.
Right.
And I did that for several years before finding out that there was more to what I wanted to learn. And one of the things I remember very clearly in residency training was that a lot of my patients had weight issues. And I didn't know what to tell them except what most doctors tell their patients. You need to eat less and exercise more.
Right.
I mean, who hasn't heard that? And if that really worked, everyone would do it and everyone would look slim and trim. But I found out through actually a brother of mine who's also a physician. He led me on to a book that I read and kind of opened my eyes to how the medical community has really kept doctors in the dark about weight gain and weight loss. And that led me to initially to learn more about nutrition through obesity medicine. But it kind of stemmed from there, Tia. Once I learned a little more about nutrition, what good nutrition is and not so good nutrition, and my patients started asking me, well, you helped me with a lot of this other stuff. You helped me get off my blood pressure medication or stop or reduce my diabetes medications. Can you help me with other things? And that's how I got into functional medicine.
So for somebody, let's say somebody's out there, they've never heard the term functional medicine before. Now, I have, because my son, who has autism, sees a functional medicine doctor, but a lot of people don't understand. So can you kind of help people understand what the distinction is?
Yeah, absolutely. Functional medicine is new, but not that new. It's been around for more than 20 or 25 plus years. And its traction has greatly increased over the last, I would say, 5 or 6 years, where more and more people understand this term. So you're saying it, but I'm sure your audience, many of them probably heard that term before. But functional medicine, is simply put, addresses the root cause of chronic medical conditions. If you can find the root cause, solve that, then you can have better health.
Okay, so I'll throw one at you. I suffer from fibromyalgia, which is a pain syndrome, and it's been explained to me that basically my nerves are overreacting to stimuli and perceiving pain as greater than it actually is, which is not much comfort for me, the one experiencing the pain, to just say, oh, well, it's overactive nerves. But if you were going to look at somebody with fibromyalgia, which I know a lot of people suffer from, what would you say the root cause of something like that is?
Yeah, so fibromyalgia is well known in the conventional world. And interestingly, it's just a word, first of all. And many people with fibromyalgia, and you would know this, is that it's whole body pain.
Mhm.
And that can be sometimes exacerbated by certain things, or maybe you don't even know. But it can also be tagged with some chronic fatigue as well. I don't know if you're having that
Yep.
issue, but so in the conventional world, we have a name for it, but not really anything that identifies what causes it or any treatments that can
Right.
necessarily help. So in functional medicine, we do understand there are some things that can create this thing called fibromyalgia. And again, it's just a word.
Right.
And so in functional medicine, we think about things like mold and fungus and the mycotoxins that those mold and fungus release that can be poisonous to your nerve cells in your body or your mitochondria, where all the energy is produced. Or it could be due to some environmental toxins that are interfering with your bodily function and causing your nerve cells to lose some of the insulating coat called the myelin sheath around it. And that can cause nerve receptors to have exaggerated feelings, or in this case, pain.
So what you're saying is that anybody with fibromyalgia should be looking very carefully at their environment to see if they have a mold infestation in their home, or if there's some other environmental toxins that could be triggering.
Right.
Mm.
But that's not, the home is one place for sure, but even foods can carry some mold and fungus. So if you've been used to eating certain kinds of foods all your life,
Right.
that are mold and fungal infested,
Right.
then you're going to have the same issue as well.
Or if you live in the South where mold is just prevalent,
Oh,
it's
absolutely.
everywhere. You know, we're hot and humid down here, so the environment is ripe for that. Wouldn't you say? Because I believe that in my case, that the fibromyalgia was triggered by a combination of toxic exposures. Namely, I had breast implants for 18 years. I had them removed in 2006. So about 5.5 years ago, I had them removed. They were saline. But I also had a series of Tdap vaccines, TD and Tdap vaccines as an adult. I had a TD shot probably about 6 months after I got the implants when I was going to Pepperdine University. It was part of the requirements for attendance. I had to get an MMR booster and I had to get a TD booster. And that was when my health problems started. Really, that was and then I had another one a couple of years later from stepping on a nail. I had another one. The most recent one was probably about 10 years ago. Every time it got worse. So then the question becomes, for somebody who's had a toxic exposure through these inoculations, these vaccines, if you will, is how then do you repair the damage? And I have two kids that are on the spectrum. We've been working very, very, very hard for my son. My son is doing extremely well. But what are you? We got a couple of minutes before we have to take a break. What are your thoughts about that as a toxic exposure causing illness?
The great question and great concern, and I think you identified it. In fact, breast implants, whether silicone or other kinds, have been known to be toxic, and they can cause an autoimmune response.
Yep.
And that's actually not an opinion. That's actually in a wonderful book written by Dr. Schoenfeld, who's one of the lead authors and leading experts in autoimmunity. And he has noticed that if you just simply remove the breast implants alone, that can greatly improve symptoms. But then there are other things you can do to help to calm down the immune system that might be trying to fight you off.
Right. It puts you into an autoimmune inflammatory state, and then if you get a vaccine or another toxic exposure while you're already in that autoimmune inflammatory state, then your reaction to that other toxin can be compounded. So we're going to take a really quick break. We're going to come back and continue this wonderful discussion with Dr. Doniparthi from Functional Medicine of Georgia.
The time to defy the modern agenda is now. UI Media Network presents Frequency Wars, an explosive new series that examines contentious subject matter pursuing us beyond our five senses. This weekly series discovers the intricacies of imposing issues that challenge our daily existence and question humanity. Provocative and intriguing, we confront the issues and conflicts affecting us on a global scale. Manipulation, manpower, or others simply controlling your mentality. The commentary and guests will shift our paradigm and defy the status quo.
In 1979, the so-called father of Israeli intelligence, a guy called Issa Harel, told an American journalist that there was going to be an Islamic attack on New York's biggest building.
Bill Gates, he is publicly saying we should consider microchipping all of humanity so we can track their vaccination status.
What you see in movies like The Avengers, that's actually true.
What will you believe? Frequency Wars challenges perception to take back your sovereignty. The power and purpose are greater than any of us, but we will test it all. Frequency Wars, the next revolution.
Welcome back to The People's Truth with Tia Severino. My guest today is Dr. Krishna Doniparthi from Functional Medicine of Georgia. We've been talking about toxic exposure and how that can lead to health consequences. I wanted to talk a little bit more about the breast implant illness because this is something that is really important to me. I have been a member of one of the largest breast implant illness groups on Facebook. It's called Breast Implant Illness and Healing by Nicole. At last check, there was 150,000 women in that group. All are at various stages of their journey, whether they're just now finding out that their implants could be the source of their issues, or maybe they have implants and they hadn't even thought about it, or they don't even know for sure that they are having health consequences, but they want to be kind of in the loop, to women who are actively searching for a surgeon to remove their implants. We have a list of surgeons all across the country, in the United States, in Canada, and around the world that are vetted surgeons that perform proper proper removal of the implants. Is called explant surgery, and that the best way to have it done, it's called in-block or total capsulectomy, which is where they remove the entire capsule, the scar capsule that forms around the implant. The moment you put an implant in your body starts to wall it off. So that scar tissue has to be removed. And, I've been in this group for a little while, and I realized that we needed a local group here in Georgia. So I started Healing Breast Implant Illness Georgia and the Southeast, which is, I think we have, I think over 1,000, maybe 1,500 people in that group. And I also run a smaller patient group for my surgeon. So this is something that really, so let's talk a little bit more about that. What have you seen? And certainly, with HIPAA law, you can't reveal any information, personal information about any of your patients. But speaking in a general way, have you had patients that have breast implants where you've suspected that the implants could have something to do with their health problems? Or do you know of patients that have had their implants removed and seen improvement? Speak on that if you don't mind.
So this is just one part of the whole spectrum of autoimmunity. So breast implants, as with any kind of autoimmune issue, whether it's, again, silicone or saline, it's not the contents of the breast implant. It's the coating. It's the thing that keeps that fluid inside, and that
the
over
shells
time
are made of silicone.
Right, and within sometimes days, weeks, months, or years, that interaction between the immune system and the outer coating of the implant is what creates an ongoing issue. And again, as I was talking a little earlier, the first thing to do is, and I'm glad you're doing this, because the explant is really kind of step number one. Yep. And you have to do that. And sometimes some people get better just from taking away the offending agent. This is true for all autoimmune disorders. If you can find the root cause, and this is what we're talking about on functional medicine, right? Find the root cause. And so if you can kind of identify that this is the cause of your issues, and it doesn't have to be like you go get an autoimmune testing.
No, those things aren't very,
right. Just the symptoms alone is suggestive of that.
Yeah.
And again, the pioneer around this is Dr. Yehuda Schoenfeld. And what he demonstrated was just this: remove the offending agent, people get better. Well, what if you don't? Is really, I think, what you're trying to get to. What else can you do? And there are things that you can do to get rid of the residual toxin. So sometimes just the explant itself is good, but how do you know that some of it is not embedded into the tissue around the breast and the chest and the muscles and the bone and so on? And so there are some biological substrates that can help remove further toxin out of the body and make sure that they don't recirculate.
Now, I've heard that serapeptase is a good thing to take to help break down any fragments of scar tissue or dead material in the body that might be left over. And this is why we stress the importance of total capsulectomy. You've got to remove the entire capsule, the entire scar tissue, because it absorbs the toxins from the implants themselves. For a little bit of distinction, you were talking about something being left over. Silicone, and especially these newer memory, the ones that you supposedly can cut in half and they're like a gummy bear. Those actually bleed through the shell. Yes. But if you have silicone implants, you really have to get in block removal, which means that they take the capsule out with the implant still inside of it, because in case the shell has ruptured or some of that silicone has leaked out, you don't want to have any of that getting through your body.
Yes.
And women that have had their silicone implants rupture, that then also had their capsule rupture, because sometimes the capsules are thin. They've found silicone in lymph nodes. They've found silicone throughout the body in different organs. So it is a really serious situation. So you have had patients perhaps who have removed the implants. And do you recommend any kind of like detoxification?
So you said a key word there. They found the byproducts in other places. So from a non-medical standpoint, the other things you can do is a lymphatic massage. Lymphatic massage is different from regular massage. There's something I would say fun and exciting about, like regular massage was relaxing and so on. Lymphatic massage is a little bit of intensive work where the lymphatic system is trying to get rid of this stuff, but it sends it through the lymph nodes for final disposal. Lots of times things get stuck there, and you need a lymphatic massage therapist to properly get it moving out of those lymph nodes. But another thing that you mentioned, and I don't know if you knew this, but there's a chance that when one person has one autoimmune disorder, their chances for another one greatly are increased. So there could be something else going on.
And I will say that if you go on breast implant illness and healing, it's called healingbreastimplantillness.com. There is a list of symptoms, and they range from, skin rashes, hair loss, gut disorders, loss of libido, weight gain, weight loss, gum disease. And these are all systems problems, right?
Yes.
These are indicative of a systemic problem in the body where, the weak points is where you're going to see the pressure, right? So, and your body is constantly trying to detox. For those ladies who are like, well, I can't get my implants out now. Can I do something to detox? How do you detox when there's a continuous source of toxins in your body? Your body is trying to push it out through your skin. That's why you have rashes. It's just, it's all of these things. So,
well, you kind of mentioned two things. So on the what can I do side, there are some natural stuff that you can take, like phospholipids, that can help trap and remove toxins and get them out of there. But that's just liberating the toxins. That's just part one.
Right.
So the next thing is, how do I mobilize it out of the body? And that's where the liver, gallbladder, and the digestive tract come in. And there are things to take for that so that the liver, gallbladder, and the digestive tract can actually poop it out, or in some cases, and not so much in this case, pee it out. And that's how we eliminate a lot of the toxins, is through our stool or through our urine. You're right. And sometimes the toxins can show up trying to detox through skin, and that is a detoxing organ as well. And then finally, the lungs are another way to detox.
Absolutely. Well, we're going to take a quick break. When we get back, I'm going to ask Dr. T. We're not taking a break. Oh, I got 5 minutes left. I am so sorry. I'm looking at the clock and getting confused. No, I'm not going to take a break. No, I want to ask you about. Yes, I wanted to ask you about detoxing from old effects. So, like is there a point in which it's better to detox? Like, is it better to detox right after an exposure? Is it harder to detox from something that's an older exposure? Like, for example, a child who had vaccines when they were very young, and now they're like in their teens. Yeah. Is there a way to kind of help get some of that stuff moving, or is it kind of hang around until you do something, or can you go back and try and get toxins out that have been there a long time?
Well, Tia, you have definitely hit a really big point. And I know we might run out a little bit of time before the break, but I'm going to start off by saying this. And this is the scary part. This is the scary part about what's going on in our environment, our community, and so on, is that we're constantly exposed to toxins. I simply call this a personal toxic burden. And each person has their own toxic burden. And so you're kind of alluding to something that, well, where are we in this process? So could you have built up a variety of different toxins and still be healthy? Yeah, or appear healthy? The answer is yes. And then you get something else happen, saying what we've been talking about. You get a breast implant or a vaccination, and then the problems start to begin. And so this is a difficult kind of subject to kind of understand, toxic burden. But believe me, the toxic burden of humans is ever increasing because of all the different kinds of things that we're exposed to, whether it's water, air, food, and personal items like cosmetics and so on. So
what about this stuff right here?
Oh, sure, that too. And that's a
whole other
subject in itself. And so, yes, knowing that, or you should start thinking about, what have I done throughout the years before I've gotten to this point? But as far as kids are concerned, believe it or not, a mother detoxes onto a child while in the womb.
Yeah, the baby's the best. They say that the best way to get mercury out of your body is to get pregnant and have a baby, because it'll pull it right out of your system. So great. Some more mommy guilt for all of us out there with toxic kids. But all is not lost, and I know that's why one of the reasons why we're bringing you on here. It's never too late. I'm taking from what you're saying, and we'll go into it more after the break. It's never too late to try to lessen your body burden and to be conscious then again of the things that you're consuming and the sources of toxins that are around you on a regular basis, so that you're not adding to the burden while you're trying to relieve yourself of the burden. And of course, when we come back from the break, we're going to talk about that word that not many people can pronounce, the Herxheimer reaction. And ways that you can avoid that, because we all need to be detoxing. And maybe we can even talk about some of the little critters that live inside.
Oh, sure. Absolutely. That's my favorite topic.
Oh, wonderful. We've all got them. It's just how much can we live with, and at what point does their population have to be reduced, right?
Yeah.
Cool. So we're covering a lot of stuff, and I think that a lot of people that are watching this are going to be wanting to know how they can come and see Dr. D at Functional Medicine of Georgia. So we'll get into all of that. Make sure you have a pen ready at the end of the episode so you can write down the website, because I have a feeling that you're going to have more questions for Dr. D after we're done. We're going to take a quick little break, and when we come back, we'll talk about the H word.
Wonderful.
If this content resonates with you, don't forget to subscribe to our channel at uimedianetwork.org to stay updated with our uncensored shows. Also, like and follow us at UI Media Network on Facebook, Instagram, YouTube, Twitter, and almost all your favorite podcasting platforms. Most importantly, if you're being censored on social media, write to us at contact@uimedianetwork.org to get your message out. And remember, keep raising that frequency.
Welcome back to The People's Truth. I'm Tia Severino, your host. My guest today is Dr. Krishna Doniparthi of Functional Medicine of Georgia, one of the gold sponsors of the Next Steps conference that took place last weekend. Despite opposition, we are not stopping, and we are going to keep on sharing the truth. That's what The People's Truth is about. And we are going to set those positive and united intentions right here at UI Media Network. We have Dr. Doniparthi. We've been talking about toxic exposure, functional medicine, and I mentioned the Herxheimer. Well, for those out there that don't know, some people call it Herx reaction. What is that? What is that nasty thing that happens when you're trying to get the toxins out and all of a sudden you're sick as a dog? And I don't ever want to do that again.
Well, just backing up just for a second. So if we do have toxins, we have to have a way to get rid of them.
Right.
And the major route is that the toxins are in our cells, they go to our blood, but if the blood is overwhelmed with the amount of toxins that are circulating, then your immune system might react and start releasing a variety of different what we call inflammatory markers. One of them just happens to be histamine, but that's not the only one. Okay. And so with the ever-increasing amount of inflammatory markers that are released, then you're going to feel bad. You're going to have all kinds of reactions. And even from the blood, it can go to the liver, and the liver is your final organ to try to get rid of toxins once and for all out of the body, and it will combine it with the bile that's stored in our gallbladder. And when we eat, those toxins then move into our digestive tract. But unfortunately, sometimes if you don't have a healthy gut, those toxins get recirculated right back to the liver, right back into the body, and you're going to have a Herxheimer reaction. So that could be a rash or feeling ill. I would call it more like a flu-like illness.
Flu-like, yeah.
Joint pains and headache and just feeling gross.
Yeah, and it makes you not want to detox. So
correct.
What are your recommendations for people to help them get through that? I know for me, activated charcoal can be helpful to sop up some of those toxins, but I'd like to hear what you're...
Well, one of the mechanisms, and activated charcoal is a good idea. That's one way. But really, I focus more on liver and gallbladder function in the digestive tract so that they don't get recirculated back to the liver and therefore back to the body. So there's some natural supplements and substrates that you can take. I personally give my patients some what's called ox bile, which is replacement bile, along with another supplement called TUDCA. And then finally, as something to help the digestive tract keep moving and stay healthy is a substance called butyrate. We actually naturally make butyrate, TUDCA, and bile, but you can take them in supplement form. I don't call them supplements so much, Tia. I call them biological substrates because we naturally make them. And they keep us, or should keep us, healthy.
Okay. Well, they say that that all health and the immune system, it starts in the gut. And I know with my son, with his autism, that was one of the first things that we focused on was healing the gut. And people say, what is autism? It's not a mental disorder. It is a gut disorder with brain involvement. And if you can heal the gut, you can heal the brain, and the person inevitably will improve. just by healing the gut. So it's all, you could almost say that if you can heal the gut, you can fix, what would you say, what percentage of problems that people are experiencing start in the gut?
Well, oh my gosh, I have an algorithm, and one of the first things I do is evaluate the entire body, but it actually starts with, what are you eating? Are you eating good food or not?
Right.
Got to start there. Do you have a healthy oral cavity?
Right.
And so I can't help you with that. That's a dentist. And so if you have some broken teeth or a chronic infection, you need to take care of that. But really, the next one right after that, that's in my purview, and that is gut health. So there's things you can do for that. And the best way to kind of figure all of this out is to do a stool analysis. And that kind of tells you several things all in one test. It tells you, do you have enough of good bacteria? And I don't know if you know, but there's over 100 trillion bacteria that help us.
Yeah, we're more
100
bacteria than
trillion.
human cells.
Yeah, more, 10 to 1. We're outnumbered 10 to 1. But if you have unwanted bacteria, what we call dysbiotic bacteria, or overgrowth of yeast or parasites, you need to get these things out of the way. So that's kind of step one to a healthier gut. And we should be eating and pooping every day. And this is, I'm sure this is not a party discussion at your next dinner party.
We like to talk about poop.
All right.
It's good to talk about. Listen, it's important. One of the reasons why we have the problems we have today is because people don't talk about these things. They don't want to talk about parasites. They don't want to talk about poop. If you go to Africa, the first thing they ask is, how are you pooping?
Sure. I mean, even in Chinese medicine, that's what they look at too. And in Ayurvedic medicine, they look at the poop. Like, is it coming out? But really, if you're not, I think we could say this. So if you're not pooping every day, there's a problem. It should be just like a baby. You know, if you remember having a newborn, you feed them, and like 5-10 minutes later, what do? They poop, and it's a constant thing. But as adults, we should, at the minimum, be pooping at least once a day, if not twice a day.
Right.
And so if that's not happening, or other things are going on, bloating, gas, belching, passing gas, and all the stomach pain, it's time to consider getting checking out the gut or doing a stool analysis.
Would you say that most people are not getting enough fiber in their diet?
Oh, absolutely. I mean, nowadays, you've probably heard the TV commercials or heard something on the internet, but really 9 to 10 servings of vegetables a day, not fruits, not so much fruits, but vegetables is the required or recommended amount, because dietary fiber does this beautiful thing. If you have the right bacteria in your digestive tract, dietary fiber gets converted by fermentation with the good bacteria to make this thing called butyrate. And it's butyrate that keeps you regular and keeps your gut healthy, and not to lead to other things called what we call leaky gut as a lay term, but gastroenterologists know this as intestinal hyperpermeability, and that is the basis for a lot of autoimmune disorders too.
Well, you've got if the gut lining is permeable and you have bacteria and you have other things getting into the bloodstream, then you're going to have all kinds of problems.
Yeah. So it could be just simple stuff as I'm breaking out a rash, I have a headache, I don't understand why. Or I eat and then I feel tired and I don't understand. So lots of constitutional symptoms.
Wouldn't you say that people also are addicted in some ways to some of the bad food that's out there?
Oh, sure. Who isn't?
Yeah.
I mean, we all are. We all like fun foods. Who doesn't like pizza and French fries and so on? We all do. But yes, they all are not the healthiest foods. And I'm not saying no, let's not cut it off altogether, but...
Well, I'm never going to eat another French fry again.
95% of the time, if we're able to eat good food, maybe we can get away with 5% of the time not eating such good food.
Right.
But we should eat natural food in the raw form. That's what God has intended, and that's what was available to us before technology.
Right. And now we have all this processed garbage that has all the sodium and the fake sugar and the fake
fake
and the
fats.
preservatives and the fake colorings and all of these things that are just
Right.
they were never part of our diet before, and now we see all these issues. So I really like that detoxing. This is a really important thing. Would you say that detoxing is something that people should have guidance from someone like yourself for?
Yeah.
I don't recommend. I do have the groups, and this is a topic that comes up quite often in the breast implant illness group. Ladies coming in and wanting to know about detox protocols and different
Yes.
programs that they can have. And I always, and you can tell me because I'm not a doctor, so you can tell me what you think. But what I always say is, no detox program within the first 6 months of explant. You got to let your body kind of settle. And then after that, the only thing that I recommend is high dose vitamin C, vitamin D, selenium, zinc, magnesium,
Yes.
and a good clean diet. For someone who wants to go deeper than that, though, they really want to do a detox protocol. I don't make any recommendations, but what is your input on whether or not somebody should try to attempt a detox program that they find online and they think, oh, I need to detox. I'm going to do this. I'm going to do this thing I found online. What are your thoughts? Speak to that as a physician.
Yeah, there's a lot of, unfortunately, a lot of misinformation about detoxification. And just kind of backtracking for just a second, detoxification means that your liver helps to convert what are lipid-soluble or fat-loving kind of toxins into something that's more water-soluble. It goes through 2 phases called phase 1, phase 2 in the liver. And only then, if it gets stuck after, say, for instance, can't finish phase 1 or finish phase 1 detoxification, cannot finish phase 2, that is a more worst case scenario. And I think that's what you're trying to allude to. But as far as can you prep for it? Sure, you can prep for it. If you're someone, again, does not have good digestive health, yeah, I would wait. Yeah, you have to be careful. Otherwise, there are things you can prep the liver for and get it functioning better. Of course, we've been just talking about nutrition. Let's start by eating better and not eating weird stuff. That would be helpful. And there are some oral or IV things that I do in my practice that helps people get ready for detox. So it kind of depends. And so the danger here could be, yes, if you detox too hard, you're going to feel really bad. And you may even feel like it's an emergency situation at that point. And so there's ways to prep and get ready to detox. But if you've never done it before, I would say, or don't know what to do, I agree with you. Don't do anything immediately after.
Just clean up your diet. Try to eat organic food because you don't want to be adding more toxins in when your goal is to start getting toxins out. I always recommend gluten-free diet, not because not necessarily everyone has a problem with gluten, although it is a very hard protein molecule that a lot of people lack the enzymes to properly break down. They're broken down into large chain peptides instead of short chain peptides. And then your body sees them as a pathogen and starts to create inflammatory reaction to it.
Are you sure you're not a doctor?
I've just been trying to heal my kid for years.
Right.
But because of even if you had all the enzymes and you could digest gluten, they are spraying even organic wheat with glyphosate as a desiccant to dry it out. So even if you're buying organic, you think, well, I'm buying organic. Well, but it still probably has glyphosate on it. And that glyphosate kills your good bacteria and sets you up for leaky gut.
Yeah, or it comes through the groundwater. They don't even have to spray it.
And then dairy has a very similar problem in being a hard protein molecule. Soy, very similar to dairy. But you know about casomorphin, right?
Yep.
So it explained casomorphin because I've explained it before as your body, you eat the cheese. The cheese makes you feel sleepy and you feel good. And there's a little pain relief going on there. But what's really happening in the
Well,
body?
casein is a type of protein found in milk. It comes obviously from cows. And that protein can be difficult. It can create an immunological response in itself. So we're not used to, just like any other animal, all animals drink their own animal milk, their own species milk. We as humans are drinking another species milk.
Yep.
And when we do that, we can develop an immunological response. Casein or whey protein can cause digestive issues and other problems.
So we're going to take a quick little break. When we come back, we are going to finish this conversation with Dr. Doniparthi of Functional Medicine of Georgia. We're going to get into a little bit of what happened over the weekend with Next Step.
Yep.
Kids, you got to clean up your diet. No more of those smackums with whole milk. It's just not good for you. All right, get your diet cleaned up. You'll start feeling better. Go see Dr. D for the rest. All right, after the break.
Just so you know, the CDC, the same organization, y'all say they're doing a great job of predicting the outbreaks with wastewater treatment facilities, but they didn't tell anybody they were doing this for the first 10 months of the pandemic. They didn't tell anybody that they were going to their water system plants, testing for SARS-CoV-2 in the water. They didn't tell you, and they haven't released that data. That's weird, and should be suspicious of the group you don't love. That same organization for the last 20 years has been using a neurotoxin that they have been putting in your drinking water every day. It's called fluoride. It is a known neurotoxin and cancer-causing toxin. The CDC's been doing that in your tap water. How weird would it be to even fathom they might be putting a neurotoxin the researchers found came from snake venom peptides that we know can be made in factories and have been for decades? I've just learned all this stuff. How do you know they're not putting it in there? It's a neurotoxin.
Thanks for sticking around to watch this episode of The People's Truth with Tia Severino. If you're enjoying this content, you'll want to head over to uimedianetwork.org and sign up. You want to sign up for a membership so that you can actually watch the workshops that took place over the weekend at Next Steps. You guys, we're going to have those up probably sometime in the next week or two. And I know everybody that was there wants to go back and watch those workshops again, and everyone that missed out because of whatever reason is excitedly waiting for those to be available. My guest today is one of our gold sponsors from Next Steps Conference, Dr. Krishna Doniparthi from Functional Medicine of Georgia. I wanted to have him on because I just think that it's so important that we support these doctors that are out here that are really helping people to get through, to gain health. And so I said, look, come on.
Yeah.
And Dr. D, you were literally the first person who reached out to me to sponsor Next Steps on the very day that we launched ticket sales. So I was so thrilled to have you be a part. And I wanted to ask you, number one, what made you want to sponsor Next Steps?
Well, that's an easy answer, Tia. This was an opportunity for doctors who have been, unfortunately, what's the word they use on the internet? Shadow banned. I mean, basically,
censored.
Doctors could not have an opposing argument about things like COVID-19 vaccines or anything else along the COVID treatment, and you risk the possibility of losing your license or being suspended. Well, this is ridiculous. This is the United States of America. I thought we had certain rights. And when I saw that your program and the event was coming out, I thought this is a great opportunity for some doctors to be able to express their opinions, medical opinions, not personal opinions, in a way that could be listened to.
So the event was last weekend. It was a huge success, despite the fact that we had a hate group that was accusing us of hate speech. The irony of it, they managed to freak out the original venue where we were going to have the event. The event went on without a hitch.
You mean a group that doesn't like big government? Yeah.
Well, so this group accused me and the rest of the organization with Next Steps and UI Media Network of being of promoting hate speech and
Not the
racism and
case.
transphobia. You were there. Did you see any of that
Oh,
happening?
absolutely not. Absolutely not. And I'm not trying to, you know,
I mean,
placate you
it
at
just
all. The
wasn't-
answer that those kind of things never came up. In fact, I think the audience that was there was from all
All
kinds
walks of
of
life.
walks of life.
Yep. Young,
So
old.
anyone who was there can attest to that. That's just nonsense.
So we had an amazing event, and you were able to speak. You were able to make some really great connections. And what was your favorite part of the event?
Well, can I say this, that I don't want to pick favorites, but man, Del Bigtree. Oh my gosh, what a wonderful speaker,
Yeah.
and
He always brings the fire.
powerful information. And I think I can't wait to see I want to see it again.
Yeah.
I want to see that recording again.
Yeah.
That was the best part. But you had fantastic speakers all day, both days.
Yeah, it was pretty amazing. What did you think of the UI Media Awards?
Oh, that was fantastic too. I was, to highlight some of your speakers and their achievement. It's not like something they just did for a month or 2 months. I mean, these are people who've been crafting their work for years.
Yeah.
Amazing.
Yeah, decades in some cases. Dr.
Yeah.
Christiane Northrup received the Lifetime Achievement Award.
Children Health Defense.
Children's Health Defense, Del Bigtree, Robert Scott Bell,
Yeah.
Jennifer Margulis. There was Brian Artis. I mean, there was
They were
some
great.
really, really great awards given. You were at the dinner. What did you
Yeah.
think of Ben Swan getting choked up?
Yeah,
over the award?
that was tear jerking for sure, and yeah, what a powerful story he had to tell everyone. And yeah, you again,
And to have him
fantastic.
say that award meant more to him than his 2 Emmys.
Right.
I mean,
yeah. So you know, he
beautiful.
turned down some big contracts just to do what he wanted to do and speak his mind.
Yeah.
I think that's really what it comes down to. Don't control my mind.
well, I would say every single one of the speakers that were at my event, and probably some of the sponsors too, have experienced this cancel culture where
Right.
the moment that they say something that's in opposition to the official narrative, they are, discredited, they're defamed, and they've had their careers in many cases
sure.
destroyed. I mean, the perfect example, of course, he wasn't at the conference, but Dr. Andrew Wakefield had his career destroyed. Del Bigtree gave up a career with CBS with the doctors. Ben Swan gave up a career with CBS, the doctors. Every single one of our speakers has had some form of cancel culture applied to their life. And so this was really an anti-censorship type of event.
That's
This was,
right.
I even had pressure to remove some of my speakers from other speakers that were originally slated to be at the event, and I was having none of it. And so, so we are not going to cancel. This is the people's truth. And my mission with the People's Truth is to create a platform where people like yourself and others can share their truth.
Right.
So we've got about, 7 or 8 minutes left. I'd like for you to talk about Functional Medicine of Georgia. Where are you? What are the services that you provide? How can people find you? And what are you doing next?
Yeah, well, again, before getting into that, one of the things that attracted me to the Next Steps event was this whole idea of masking the truth and not being able to speak your mind, right? So what have people been saying about some of the things around COVID-19 was that, hey, there's some problems here. Can we just kind of address it? And when people were having health issues show up after an infection or after a vaccine, no one wanted to listen. They told you, it's all in your head, or you're making this up. Why are you doing this? And now, guess what? CDC has put out a list of things that called long hauling. And long hauling is the after effects of either the vaccine or the infection or both.
Right.
And so
Long-term health consequences.
Yeah. And there's a list. I mean, if you don't have to take my word for it. Go to the CDC website, look at the long hauling list. It's very extensive. It's over 80 different symptoms that people can have. Probably worse than any autoimmune disorder I know of. But I do help people with that. But functional medicine of Georgia is all about health and wellness. I mean, that's really what it comes down to. I mean, we always start with the most basic things is to nutrition, stress reduction, better sleep, take some supplements, detoxify. And if you still need more advanced help, then I can help you with those things too. And right now, it happens to be on the cell regenerative side. Like, how can I get stuff out of my body if I try everything else and I'm still not feeling better? And you might go to another functional medicine doctor or see something on the internet and say, let me try that. And it doesn't help. I'm your person. So on the cell regenerative side, I'm trying to help people now. Our biggest tsunami in the medical field might be this whole idea: what happens long term after getting a COVID-19 infection? Do you develop some autoimmune disorders, or could you have long-standing problems that can then unfortunately lead to bigger things? The worst one would be death. And I think we've seen some of that data come out, and I think more is being found out every day. But functional medicine of Georgia, we focus on you as a tailored patient. So it's not a one-size-fits-all. I'm going to do things that are only things that are necessary, and it's based on your findings and your symptoms, and so it's personalized care.
I think we all have been screaming for personalized care through this whole thing. They want to kind of shove us all into one box.
Yeah.
Nope. You gotta get the test. You gotta get the vaccine. If you get sick, you gotta sit at home until you're really, really sick, and then you come in, and we're gonna put you on the ventilator, and we're gonna put you on remdesivir, and we're gonna basically, well,
even some people have had some side effects, and then they've gone to their either the emergency room, they've seen a cardiologist, a pulmonologist, an infectious disease doctor, a gastroenterologist, and still they say, oh, we can't find anything. I'm sorry, we can't do anything for you. I mean, it's tragic, and it breaks my heart. And I think there's some websites out there that are taking in the stories, and the stories are tragic and tear-jerking for sure.
Yeah. Well, we've certainly seen more carnage from this than any other, and I don't like to call it a vaccine. It's not a vaccine. It's gene modification, gene therapy. It's an experimental use, emergency use only, but we've never seen this kind of death and destruction.
Right.
And people, it seems like it targets your weak point. So if you have lung issues, it's going after your lungs. If you have heart issues, it's going after your lungs. I mean, your heart. If you're diabetic, it's going after your pancreas. If you have kidney issues, it's shutting down your kidneys. So really, we need functional medicine to find our way out of this mess.
Make us healthier, really.
Help us get out of this. I think that for those who have taken the experiment, that there is still hope. Again, God created this incredible human body, and it's capable of pure miracles. We've seen people that have, faith healing is what comes to my mind. Yeah. So even without the help of a functional medicine doctor, some pill or supplement or any other intervention, pure faith has healed people. So we know that the body is capable of doing it.
Sure, and
so where we may be lacking a little bit in faith, we can hopefully support the body with what it needs.
I'm with you. God has given us the knowledge and the things on earth to take care of ourselves.
Absolutely. So before we go, I need for you to please share with people how they can get in touch with you. Functional Medicine of Georgia, what's the website? Any other information, email, however you'd like for my audience to get in touch with you.
So I'll say it a couple of times, but it's Functional Medicine GA for Georgia functionalmedicinega.com. So functionalmedicinega.com. And our phone number at the office is 678-242-0204. 678-242-0204.
All right, so you heard that, folks. Now you know if you didn't have a good functional medicine doctor, you know where to find one. If you're here in Georgia, anywhere in the Southeast, really, I'm sure you probably have people that travel from around
They do.
The Southeast to come see you. Well, we're lucky enough to have them just a few minutes away. And we just really thank you again for coming out and
thank
supporting
you.
Next Steps and for coming and sitting and talking with us today. And you guys, pay attention, get healthy. You've only got yourself, so you got to make yourself the best you can ever be. And that includes taking care of your spiritual health, your mental health, and your physical health. So we hope that you do that. Come back in a couple of weeks. We'll have another amazing guest on The People's Truth. And until then, take care of yourselves. I love you. Bye.
Whoa, my mind has officially been blown wide open. As yours? Keep sharing the show and join us in our mission to educate the world with uncensored truth. As they say, together we are stronger, our voices louder, and the synergy of our actions more powerful. If you have any comments or questions for Tia and her guests, send us an email at contact@uimedianetwork.org. Until then, stay safe, stay tuned. The UI Media Network and its associates take no responsibility for the opinions and statements made by the talk show hosts or their guests.